Hello, my name is Uchenna Ume. I am a rising freshman at Kennesaw State University in Georgia. What if the fastest vaccine ever made saved millions in under a year? The most surprising and impactful scientific finding in the last 5 years would be the discovery and creation of the COVID-19 vaccine. Exactly 5 years ago, the coronavirus pandemic, known as COVID-19, was on the rise, with many nations reporting more cases of people affected by the virus and even more deaths. The world was shut down for months. Schools were closed, jobs were lost, supplies were low, social distancing was implemented, and abuse was at its high. Some effects on the human body were loss of smell and taste, diarrhea, shortness of breath, body aches, and death. COVID attacked the lungs, heart, kidneys, brain, and blood vessels, causing strokes, heart inflammation, and clots. Brain fog, fatigue, and loss of taste and smell were a part of long-term COVID, which affected people for months or years after infection. There was no known cure, and scientists were racing against time. Within days of sequencing the virus's genetic code, researchers at BioNTech, Moderna, and Pfizer built vaccine prototypes using mRNA technology. Rather than injecting the virus, these vaccines taught our cells to recognize and fight COVID using a snippet of genetic instructions. Then came trials of administering experimental shots for the vaccine, but through many ups and downs, the vaccine deemed effective with a 90% success rate from Pfizer in November. This was a surprising achievement, once thought impossible, because in the past, most vaccines took about 10 or more years to create. The difference, though, was the fact that COVID had been quietly researched for years, and scientists already knew of its structure and how to target it. There also wasn't a long hold between trials, waiting for funding and approval, as the government announced Operation Warp Speed, which partnered the Health and Human Services with the CDC to provide billions of dollars to speed up production time. The impact was immediate. Lives were saved, families reunited, schools and workplace reopened, and perhaps most remarkably, the success of mRNA paved the way for treatments beyond COVID, for cancers, flu, malaria, and even autoimmune disorders. The COVID-19 vaccine didn't just protect people, it redefined how we understand biology itself. It proved that we can harness genetic instructions, deliver them into cells, and trigger the body to create its defense. It also showed how interconnected life is. A virus jumped species, spread globally, and forced humans to decode nature's playbook at record speed. By mapping viral RNA and manipulating human cellular responses, scientists uncovered new layers of how genes, proteins, and immune systems work together.